For network building?
Yeah.
Yeah, I mean, I think, the first thing that's important is that, everyone has to, think about how you can positively use, LinkedIn and those types of tools, because there's no doubt of how important it is to utilize a network like that, particularly for your professional network. But more importantly, I always encourage people that they need to have mentors. And for those of us that can, we also need to mentor. We have a moral obligation to help those in the way that we've been helped. It is critical to do that. And I know I would not be where I am today if I didn't have phenomenal mentors in so many ways, both personally and professionally. And the second thing is I always encourage leaders at all ages to have a personal board of advisors. People who they can go to, people who can help hold them accountable, they can bounce ideas off of, could be challenges with their career, but just a group of individuals who can just be there for them and be thinking about them. It's just very, very critical. And then the other thing, as I mentioned, is be willing to take on new challenges and risks. And as I mentioned earlier, don't let anyone define your generation. You define it. You show them what you can do.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 73. Hi, everyone. Omari Richards here. Thank you all for joining me today. Be sure to subscribe if you haven't subscribed as yet. It greatly helps get the show out to more people and just continues to boost it up on all the different platforms. So be sure to do that on whatever platform you listen or watch this to. Make sure to like, share with a friend. I greatly appreciate that. And if you do want to support, you can go to buymeacoffee.com/the PH Millennial and support there as well. I really enjoyed today's episode. It's a lot different than a lot of other episodes that I've spoken about. And I think this person has a lot of experience, and he just talks about the value and like being a relationship builder and a network builder, and just how those skill sets are transferable to different settings like healthcare, to higher education, to public health. So I think it's something that you all should all pay attention to, as well as there is this really cool equity impact scholarship for more equitable healthcare workforce that is happening through his work at Digital Health Global Education. So definitely check that out. I'm going to leave a link to that in the show notes as well as the podcast description. But without further ado, I hope that you all enjoy this episode. Enjoy. Today, we have an expert in driving continuous success and development of healthy communities, networking and partnering with key officials and leaders, and producing multiple innovative programs. He got his Bachelor's of Arts in Political Science at Moravian University, then got his Master's of Public Administration at Eastern Stroudsburg University of Pennsylvania. He currently is the Senior Vice President at Dignity Health Global Education. We have Geoffrey M. Roche, MPH. Welcome to the show.
Thank you so much for having me.
Yeah, it truly is my pleasure. As we were speaking about before, you have a very unique position. I'm very excited to share your story and more about what you do.
Absolutely. Happy to be here.
Glad to have you. So how are you doing, and how you've been coping during the pandemic?
I'm doing well. In fact, actually, I received my booster shot today, and thus far doing well. But certainly, it's always when I reflect on the pandemic. To your point, I think it's definitely been a challenging time for everybody. We have three boys, and so while my wife and I have been fully vaccinated, and we've continued to be safe for our boys because they can't be yet. They're young. They're all under the age of 6. And but thank you for asking. How have you been?
I have been doing well as well. Moving to a new state, a new place during the pandemic has been interesting, but I think I'm integrating very slowly. But I'm very appreciative for all the great things that have come out of the pandemic, as sad as it has been. And yeah, I think like a lot of parents are definitely battling or juggling with being safe and getting back to some sort of normalcy, as well as when the kids can't be vaccinated. And it is just very interesting and unprecedented times, that is for sure. So I hope that we can we can hope that the pandemic definitely slows down and we can get the cases to slow down and then just, get some progress and get back to more normalcy in sometime soon as well.
Yeah, I agree.
Awesome. So tell me, how do you identify, and then tell us a little bit about your personal background?
So I identify he and him, and specifically my personal background. I started my career in June of 2008, and I always tell people I'm the son of a nurse, and so healthcare was always a major focus of our home. Obviously, every night, my mom would talk about she was a maternity care nurse, and so she would always talk about her role in nursing. And I would always, at oftentimes, she would take me to work during your, take your child to work day, and so I would get to see the work of a nurse, and oftentimes, would actually make a mess of the nurse information desks and stuff like that as a young kid. And I never would have thought that I would end up in hospital administration because actually during high school and in college, I actually worked for several government officials. I'd worked part-time for a state senator, and then also worked for a state representative, both during high school and college. And then junior year of college at Moravian, I did a Capitol Hill internship. And it was really that internship on the Hill that really opened my eyes, not only to policy, because obviously I had done a lot of stuff, was a political science major, but health policy, particularly obviously at a time when there was a lot of discussion surrounding healthcare. At the time, it was 2007, so obviously before the Affordable Care Act, but there were a lot of conversations occurring, leading into the presidential year campaign and such at that time. And so that was certainly one important element. And then in my senior year, my late academic advisor had said to me, I think you should do an internship at our local regional healthcare facility. And so I did that, and it was a semester-long internship in what was then the government relations, public affairs, marketing department of Lehigh Valley Health Network. And, I was hooked. I saw a lot of what I thought would be a really interesting aspect. And so I started in June of '08, initially as the coordinator of community relations for what was then Pocono Health System. And in that role, I was responsible for not only being the eyes and ears and being the hospital spokesperson, but also to work with colleges, businesses, schools, basically everyone to build relationships with that ultimately would support our health system and our mission, vision, and values. And so I was there for over 9 years. And, interestingly enough, during my career and my time there, was fortunate to experience a lot. Got to build their government relations program from scratch, which led to a lot of involvement in Washington, D.C., actually quite a bit, specifically with the Affordable Care Act, where we were a hospital that was receiving additional funds. And so I had opportunities to work with lobbyists and work with members of Congress and host members of Congress and bring senators to our hospital and work on a lot of those things as well. And so continued to just grow, both personally and professionally, and ultimately had a phenomenal CEO who was a nurse. And why I mentioned her too is she was also a strong proponent of public health. And in 2009, 2010, we actually started our community health needs assessment before the Affordable Care Act required it. And I was the person assigned to run it. And so we worked as a team and worked with what was then East Stroudsburg University's public health department to develop our first community health needs assessment, the whole process, the data methodology. But then more importantly, I had the privilege of working with our CEO to develop what we called our community health connections, which was essentially how we would involve the community at all levels: schools, law enforcement, faith-based, cultural and ethnic organizations, you name it, healthcare, far and wide, in what would then become essentially the implementation body for what we learned in the needs assessment. And that was, again, really interesting experience, because here I was leading it, facilitating it, wasn't a public health person, but really learned how much I loved and valued and appreciated how much public health meant, not only to us as acute care health system, but more importantly, the whole community. And so, continued that work for many, many years. The team was expanded and worked with, phenomenal other members of the team, brought in more people who actually had a MPH and had other experiences in public health. And we continued to do incredible work in the community, everything from a community safety program where we would go in and educate the youth at a young age about driving safely and wearing seatbelts, to, substance abuse and drug abuse and, alcohol education, to, you name it. And my role in the needs assessment really led to more and more leadership opportunities. And then, a few years after my starting there, I was made the director, and then had everything from strategic planning, business development, community health, community engagement, government relations, and EMS, which was interesting. So again, another very important element of our public health infrastructure was EMS. And so I was asked to lead that, which included EMS education, as well as EMS operations, ironically, because we acquired an ambulance company and continued to do that work. And so, I have really been blessed, particularly in my healthcare career, to literally experience everything from pre-hospital to acute care to post-acute, and then a lot of public health, as I mentioned. And one of the things that I'm most proud of, particularly, was the work we did. And this was in the Poconos, so very fast-moving tourist area, very close to New York City, just a little over an hour. The work we particularly did around community health, and everything from providing better access to care for the homeless, where we would meet them where they were at and not expect them to come to where we were, to a number of initiatives with other organizations, nonprofits and such, on immunizations and a whole host of things. And when I look back, without question, those 9 years were amazing. And I'm fortunate that I worked for a CEO in acute care who understood that acute care hospital organization also has public health responsibilities. And as we've gone through this pandemic, it reminded me oftentimes, because obviously, even though I was at a hospital, I did a lot of work in my 9 years as well with the Department of Health, and was involved in a number of initiatives. Our state health improvement plan, served on committees under the Secretary of Health, and you name it. And in 2009, as you know, we had H1N1 in the United States, which had a profound impact. And fortunately, H1N1 was managed much more effectively than COVID-19 in terms of how public health mitigation. But H1N1 was another area where I was asked by our leadership team to work with our infection control and infection prevention team to put together immunization plans and work with then Sanofi Pasteur, which Sanofi literally was in our community, so we had a phenomenal partner, and we worked hand in glove, from making sure we educated our community to working with workplaces to working with our schools, et cetera, to keep everyone safe. And ironically, I never would have thought that that's some of the work that I would have done. And I can remember the dean of public health at the university at the time, who's now gone on to serve as a college president in New York, would sometimes say to me when we were working together in a needs assessment, he's like, my gosh, I never thought I would have worked with someone who didn't do anything in public health from a degree end, but knows so much about public health, by the end. And so I really, took it really on and learned as much as I could, and partnered with everyone that I could imagine, because to me, what I learned was that public health is not dissimilar in any way from, community engagement. And really, at the end of the day, we're there to serve, and listen to the experts and do what we can to keep everyone safe.
Okay. Thank you a lot for that overview. I really appreciate it, and I definitely wrote down a lot of questions that I'm hope I'm going to remember to ask you when we get to those different parts of your story. But I think it's just so important that, as you said, like you were interested in it from your mom being a nurse and going into there, and then you got interested. Well, you went to school for political science, and then you got into government affairs, and I feel like that kind of played into your community engagement and wanting to build relationships and networks and those kinds of things. And then like one thing that I'm really excited, like the needs assessment, I think that's a huge part of public health, and it's great that you're able to do that. But I thought it was very interesting. You said that like doing the community health needs assessment led you into leadership, and I'm definitely going to ask you more about that a little later on. So before we get into your bachelor's and everything else that you mentioned there, as well as the current job that you do, what does public health mean to you?
Yeah, so public health to me really comes down to, the idea that what I do to stay healthy and well impacts everyone else. And so, at the very core, it really is the aspects of health around each and every one of us, and how we choose to live, particularly with when it comes to infectious disease, obviously impacts those that are around us or those that come close to us. And so, for me, however, I will always say that public health, by the very nature, is expansive. And therefore, it also means education. It means advocacy around it. And more importantly, it also means care. Care for one another, support for one another, and service to one another, all around keeping everyone healthy, safe, and well.
Okay, I love that a lot, and that's a very all-encompassing answer, which I think is very public health. So yeah, I like that. I like that a lot. So you got your bachelor's of arts in political science at Moravian University. So what was the thought process for that? So tell me about that.
Sure. Yeah. So, as I mentioned, having worked for a state senator and particularly during high school, at age 12, a dear friend of our family sort of started to introduce me to politics and would take me to county political meetings. And ultimately, I was working on a campaign at age 12 for a judge candidate. And, I think at the very core, as you alluded to before, I've always been a relationship builder. And, to me, the idea of being able to build a relationship to advance an outcome or advance a cause probably is in, without question, I shouldn't say probably, but without question is in my DNA. It's just who I am. And so that strong desire of service was really embedded in me by my parents and also my grandparents. And so, that perspective when it came to college was, I like government, I like politics, I'm going to study that. At age 18, I became in the state of Pennsylvania, or in the Commonwealth of Pennsylvania at the time, I was the youngest appointed official. Our township had appointed me as the township auditor. And so at the time, I was also, at some point I may, take this to another level. So that's why I did it. And, political science to me was much more than just studying government. It was also studying laws and getting a sense of, how government officials at all levels certainly influence the lives of all Americans, but also all international residents too, because of who the United States is. And so, for me, it was just that desire to study more, get a sense of also international politics, how American politics and international politics merge and integrate, and then that just, again, that desire to learn more about service.
Okay. Well, thank you for sharing that. I think that's awesome, and I think a lot of people don't even realize just how much government. I feel like the systemic policies play such a large role on everything that is underneath it, and people. I don't know if they're disillusioned, or I don't know if they, even that's a word. If they don't if they just don't see what effects like those bigger policies have on it, because some people are just like, I'm not going to vote because it doesn't matter and those kinds of things, but it does matter because even if it's just your local election, these are the decisions and the things that are running, like how your schools are doing and all the different funding streams, and what are, like, as you said, what objectives are these people trying to achieve. And I think it's so important to be involved and to know about it, especially in this public healthcare world, especially when things are very complicated, and when policies change, a lot of complexities come with that, and a lot of needing to know new things and educate people about that, especially the consumer, the patient, the client, the just lay person. So I think it's hugely important that you said that. And then earlier on, you were saying in your junior year you got a Capitol Hill internship, was it? So how do you get that? And then tell us just a little bit more about what you did in that.
Yeah. So it was an application process, through Congress. I applied and was accepted, and then interned for a summer long. What was then my member of Congress, former Congressman Paul Kanjorski. And it was a really interesting time for an internship because it was also the economic downturn. And so actually Congressman Kanjorski was the chair of the Capital Markets Subcommittee. And so, during my entire internship, the congressman was on the phone with the likes of Ben Bernanke and Bush officials talking about the economic downturn. And it was a really interesting experience walking the halls of Congress as an intern, and getting to go into the very rooms where they negotiate all these massive deals and bills, and ultimately what become law, and do it in a way that you felt like you were part of it. And so as an intern, we were, responding to constituents, we were, entering data, we were answering the phones, but we also had the awesome experience, because the way Congress had developed it, to go to the Congressional Speaker Series, and, had the privilege of meeting Speaker Pelosi, and, Leader Hoyer, and, really experiences that you never forget. And one of the things I can remember Leader Hoyer saying to our group was, hey, out there, all of you, you better become future leaders, because we need younger leaders, in roles like they're in, more than ever. And it was really, really a neat experience. And then we would also do tours, when residents and constituents would come down, which was also cool because we would get access to places that the public don't always get. And so that was pretty neat. But one of the neatest experiences of the entire internship was also just the sheer fact that at the end of it, the congressman took us to lunch actually in the Senate Gallery restaurant, which is where all the senators, do all their deals. And so, to sit there with the congressman and have, all these other members of Congress from the Senate and House coming in and such was just really, really a neat experience. And so it was also actually that time where I chose to focus more on my health. So, I had always had some challenges with obesity. And, my mom was a nurse, so I would always hear about how dangerous that was. And at the time, now my wife, but at the time, my girlfriend was always encouraging me. And it was a summer where I just decided, hey, I'm in DC, great places to run. Started to actually, run, and ultimately in a summer, ended up coming back to college, having lost around 50 pounds. And then just continued because it was just something that I saw the benefit from. And in the end, over about a year, lost over 100 pounds, and was a transformative personal experience for me. And, that time in DC actually helped me really identify with that opportunity to do that.
Okay, that's amazing. Thank you for sharing that. And that truly is amazing. 100 pounds in a year, that's no joke. So like, congratulations, and I'm glad that you were able to like see the importance of health and like take the actions to really improve your health. And it's probably helped you a lot in a lot of other just things in life, just getting you to be more focused. And I think like just forming those positive habits and those positive lifestyles are what we're like trying to push and do, especially in public health rules. So thank you for sharing that. And then you said in your senior year, you had an internship at the local healthcare facility. And I thought it was interesting because I feel like not a lot of people talk about like the government relations or affairs part of the healthcare organizations. And I wanted to ask you a question before I actually talk about this. You did like go into the Senate and sitting down there in the lunchroom. Was that like, were you a relationship builder before that, or were these experiences something that made you want to become more of a relationship builder, networker type of person?
Yeah, I mean, I was definitely a relationship builder before that. I mean, even in college, was in student government and you know, very involved in a number of other, aspects. And again, even during college, I was working for a state representative and served and worked on, many campaigns. So without question, I was a relationship builder. However, there's no doubt of the impact and influence, that Capitol Hill internship had as well, because I got to see, you know, another very important element of government in action. So I had seen state government because I had worked in it. I saw local government, and in that federal government experience was just a really, transformative one as well. And again, you know, it's interesting all these years because some of the folks that I worked with in that office have gone on to be really influential in a number of areas. One of the, for example, at the time, the congressman's legislative director is now the executive chairman of the board of the National Credit Union Administration, who just yesterday was presenting at a hearing to the U.S. Senate. And so, when you look back on those experiences, it's amazing to think I was in the halls. I was in that office, and the congressman had been there for roughly over 20 years, so he was very senior, very well respected, and cared deeply about giving these experiences to students in his district. And in fact, all these years later, his chief of staff is actually a neighbor of mine now. We live in the same community, and I serve on our local school board. And when I ran for school board, she remembered me as a young college student, as an intern. And so it's just really interesting when you look back on something like that and how it changes you.
Yeah. That's awesome, and that definitely must have been a great experience. All right, so your senior year, you went into a healthcare facility and you were in the government affairs side of things. So tell me more about the work that you did there.
Yeah. So when I was there at Lehigh Valley Health Network, my role was really, I would go everywhere with the vice president. And so that meant going to Harrisburg, meetings in the state capitol, meetings with lobbyists on issues that the hospital cared deeply about, funding, reimbursement, grants, etc. Meetings in the hospital, meeting with various other leaders about just their challenges, whether it was nursing or care, case management, medical staff issues, etc. Because really government relations not only is lobbying, but it's also advocating. And so, being aware of those issues so that the vice president was informed to then take those issues to, a government official to work to solve them. So, for a semester long, I got to go to Washington. I would go to Harrisburg with her, spend time at conferences, meetings in Washington, as well as Harrisburg, as well as in the region. So I would also work on, reports and website updates and such, because they had an internal website to keep the leaders informed of all the different government affairs activities and those types of things. One of the most, without question, highlights of my internship, though, was it was the presidential year when President Obama ran against then Senator John McCain. And John McCain actually visited that hospital. And so I was there the day he came to visit, and so, while he was not my preferred candidate for president at that year, it was really neat to have met him, been a part of the team that set up the event with Secret Service and his campaign. Again, he was coming as a candidate for president, which meant as a not-for-profit healthcare system, we also had to extend an invite to then Senator Obama, which we did. And he was coming specifically to talk about telehealth because we were a hospital, or they were a hospital that had a lot of telehealth capabilities. And he was coming to talk about that and then tour the facility. And so I was part of a small group that helped set up the event, and then also there for his entire speech. And so, that was really neat as well, because irregardless of politics, the late Senator John McCain was truly a war hero. And what you saw, on TV, and what you saw, in the campaign, is what you saw in person. Just such a respectable person, and very thoughtful, is what I remember as well. And so that was a really neat experience for a college senior, to have, irregardless of, party.
Yeah, yeah, absolutely. And that must have been really cool to be able to set up the events and work with Secret Services. I don't think that's a thing that people typically get to say that they have done. So
Oh
that
yeah,
is
and they would
awesome.
scope out every little detail of everything. It was definitely, a really interesting, exercise without question.
Okay, okay, that's awesome. So tell me, you got your bachelor's in political science, and you said you had an internship at Capitol Hill, so you had more like health policy type of stuff. Now you have this internship in a healthcare facility. Your thought process going forward, was it that you like working in the healthcare facility, or you were thinking like I would go back into health policy at this point in time?
Yeah, so to be honest with you, after my Capitol Hill internship, I was, almost entirely focused that I would get a job in DC. That's what I really thought. But when I started to understand what, the job opportunities were, how expensive it would be to live in DC, and what you'd make in those positions, particularly on the Hill, I was like, that's not going to happen. And so, I knew I was coming out with college loans. So, obviously I went back, to finish out my senior year. And remember, after the internship, I was entering my senior year. So I did my internship with Lehigh Valley. And when I started to think about what it would be that I would do next, I loved my internship. And so, the aspect of government affairs, the aspect of community engagement, I thought there was definitely something there, because of my love and passion for building relationships, and again, advancing initiatives or causes. So from that vantage point, I moved very quickly, to consider mostly nonprofit, job opportunities, because I felt that was going to be very much where the cause and mission, associated aspects would be. And so as I continued that work, I learned of the position at then Pocono Health System. That was the hospital my mother worked at. And so, I knew it. It's also where I grew up. I didn't think that's where I would have ended up, particularly, but then, ended up getting the job, and then was there for 9 years. And as I mentioned, went into leadership, and never would have thought that I would have been there for 9 years. But to be honest with you, I would still be there, if it wasn't going through a merger process, which ironically was with Lehigh Valley, Health Network. So it kind of came full circle. But also, as you know, sometimes in acute care, when they do a merger, uh, positions are eliminated. And so mine was one of them, director level roles. Ultimately, most of the director level roles at our hospital were eliminated because of right sizing and such. And so, that was an interesting experience as a younger professional to go with, and experience and go through. But, very, very humbled, and very thankful for the experience that I had for 9 years.
Yeah, yeah, absolutely. And that's awesome that you're able to go back home, even though it wasn't where you're expecting to be. And as you said, you're able to do a lot of great work there. And I feel like all of the work that you mentioned in like when you initially spoke about it was a lot of public health related things, and like a lot of forward thinking things that a lot of health systems I think are struggling to do or think about today. And you all were doing that a long time ago, which is great to hear. And then you also mentioned that you in your internship that they were talking about telehealth, which is awesome in what 2008 2009. That is crazy. So after your bachelor's, you became the director of public and government affairs, community health, business development at Lehigh Valley Hospital, which was first Pocono Health System or something of that sort. So you were talking about you did like a lot of community. What was the how did you get involved in the community health needs assessment here?
Well, essentially because of the president. Our president, when our president decided how we were going to do it, she said, you're the person that works with community relations. And remember, at that time, I was the coordinator. I hadn't been promoted to director yet. This was all part of her plan. She wanted to give me more responsibilities to prove that I could do it and then eventually promote me, which she did. So that's how I got in it. I was designated by the president and CEO and knew this was a major priority for her. Pulled together an internal team, obviously worked with the university. And then, that became, in my entire time there, we ended up doing 2 needs assessments, which I ran and led. But it was both the needs assessment and then the implementation plan, which, as you know, is required by the Affordable Care Act, became, without question, everyday part of my role. Because for us, community health was a fabric of our healthcare system. We didn't view it as something you have to do. We viewed it as it's a must do. It's part of our responsibility as a anchor of the community. And I think that's a real important difference sometimes, is that you'll see acute care facilities who just do it because they have to do it. We, were led by a CEO who truly in her heart of hearts felt, and I think she was inspired by this because of her service in Newark and in New York City, where obviously she saw a ton of community health challenges. That even though we were in a more rural suburban community and still had very tough challenges, that it was our responsibility, because there was no county public health department, to own public health and to do it for the right reasons. And that was to improve the health of the community. And so, when we did our mission, vision, and values, our mission was to provide world-class healthcare to the community. Our vision was to build a healthier community. And so everything we did from a clinical end to a planning end was also very, very much around public health.
Okay, that's awesome. And that's cool to hear that the CEO said, let me give you some more responsibility for you to prove that you could handle it, and then put you into the director's position. So tell me more about that, because you said that the community health needs assessment was something that kind of pushed your trajectory in leadership. So talk more about that.
Sure. Yeah, it very much did, because it, again, I was working with, public health experts at the university, both faculty and students. So I was learning, from individuals who, had doctors of public health, PhDs, researchers, statisticians, and things that I had really no knowledge, no expertise in. But what I did know was how to build relationships. And I knew that when it came to the implementation part of a plan, that if we didn't build relationships, if we didn't advance the cause, particularly with schools, law enforcement, other nonprofits, faith-based, different cultural and ethnic groups within the community, that it would just be a report that sat on the shelf, which is oftentimes, unfortunately, I think, how some healthcare organizations view it. And so, that's not how we wanted it to be. In fact, that's not in any way what our CEO would have allowed it to be. And so when I mentioned how with our CEO, we came up with the idea of what we called community health connections. It was really around the idea that without connecting with our community, we would never improve or advance community health. And so that aspect of connecting was almost like threading a needle. We would go to business groups, employers, civic groups, talk to them, hear from them on the issues that were occurring, and then figure out solutions. And that's really what formed, based on the data of the needs assessment, into creating 2 groups, because the data was clear. In our first assessment, the biggest issue in our community was obesity and chronic diseases. And then the second was mental health and substance abuse. And so we formed 2 groups, and we brought leaders from all the different sectors to the table who would work on those issues monthly, and would report back, and we would go after grants together, and we would set up initiatives. And that needs assessment was powerful because it led to a number of initiatives. And there are many, but, some that come to mind in particular were, um, we learned, particularly on the mental health side, that we needed to expand the offerings. And so that meant we needed to do more screenings. We needed to think about integrating behavioral health with primary care, which the VA had done many, many years before. And so I was tasked with leading that charge. And so I wrote a business plan, worked with our team, and came up with an ultimate plan that hired two psychologists and placed them in primary care offices. And it was a profound impact. It took away the stigma. It provided access in a care setting that patients felt comfortable. And what was really awesome about it was that it had services like OBGYN and and other primary care, internal medicine things that, if they saw something in the patient that concerned them, they would immediately just send them right over. And instead of, hey, you got to book another appointment, it was part of the care plan. But also, it led to more health screenings with employers, more relationships with small business and large business, to really, again, look at the heart of how would we move healthcare forward. And also, it's what led our work in the schools. We knew we had to reach students earlier and parents and school folks. And so it really was a labor of love because we were able to truly engage with our community. It led us to also realize that, for some harder to reach populations, we'd have to bring care to them. And so, as I mentioned about the homeless and other populations, it led to being, thinking outside the box. And it was really just all about that.
Okay, sounds like some great work, and as well as like just being able to build that leadership. And like as you said, it like a community health needs assessment, or like a needs assessment just in general, could just be a document that goes on the shelf that nobody reads. And I think, like as you said and alluded to, it's so important to embed the community into that process so that they can take ownership, leadership, and like see that, okay, these are the solution or the issues that we are seeing, and we can come up with the solutions to really get at those issues and try to come and get better health outcomes. So I think that is like super, super important with any kind of needs assessment, community health needs assessment as well.
Yeah.
And then after your 9 years here, you decided to go get your Master of Public Administration at East Stroudsburg University of Pennsylvania.
East Stroudsburg. Yeah. So actually, I did my master's when I was still at Pocono. Okay. I started it, ironically, actually, I started it in January of 2009. I didn't finish it and earn it until December of 2015. And so that means I took a period of time off, actually, between 2009 and 2012, which mainly was I started it and then I realized, oh my gosh, I'm so busy. I don't know how I'm going to do this. At the time, my wife and I were getting married. There was a whole host of things going on at work, more responsibilities. And what was awesome about my MPA was that because I was doing so much community health work with the university, I was able to get permission from the faculty that actually some of the courses I took as part of my MPA were actually were actually courses in the public health masters. And so I took, courses on public health ethics. I took courses on public health law. And so instead of some of the other courses that I would have taken, because my employer was paying for it, in many cases, I wanted it to also be of value to them. And I'm really glad about that too, because it was a much more well-rounded master's in public administration, because it also presented me the opportunity to view public administration from the lens of also healthcare, which is important because when you think of public administration, you think of government. And so that was really important to me.
Okay, yeah, that's awesome. And I think it's important. You said that you started it and you had to stop it because life and you thought that you had more time or more energy and that just wasn't the case. And I think also during your time during your MPA, you had a rural health fellowship at the National Rural Health Association. So was that in the beginning part towards the end part? And tell me more about that.
Yeah, so that was 2014, if I'm remembering correctly. And, that again came entirely through the work that my CEO was doing. So she was on the American Hospital Association Metropolitan Policy Council, and as a result of the work she was doing there, we were doing a ton of work in rural healthcare because at the time we were still deemed a rural healthcare community. And as a result of that, we would have different funding methodologies that would come into our healthcare system. And so as I started to do more and more with rural health, I had learned of the opportunity, applied, was nominated, and then ultimately accepted into a small cohort. And it was only about a dozen or so folks from all around the country who were part of the fellowship, year long, and met some of the best people in my life. Got to work on projects. Actually, we ended up doing a paper. That was the first time I did a quote unquote academic publishable paper, which we looked at the regional variation, particularly among the health in rural communities of those workers who work on farms, and particularly the difference when you have individuals who may come from other countries and work on farms who don't have access to health insurance, yet are here doing the work that ultimately provides us food, yet don't have access, and what does that do to the overall healthcare system across the board? But then more importantly as well, it was a fellowship that looked at all the aspects of the differences that rural health, or I should say rural communities, face when it comes to healthcare. And that was very well rounded. So it looked at, again, not just healthcare in the lens of acute care, but also public health. And brought together people of all different backgrounds, people that were academics, people that were clinicians, people that were like me. And then ultimately we ended the fellowship with having to present our paper to the whole group, as well as what they called Rural Health Congress, which is where they brought together CEOs and leaders from all different healthcare systems, as well as public health, state health departments, offices of rural health, obviously the federal government's Office of Rural Health, which is in HRSA, et cetera. And those were the people we had to present our papers to and ultimately be accepted and approved and graduates of the fellowship. But again, what I got out of that fellowship was without question the challenges that one community faces. We all think we're all alone, but then we realize there's other similar challenges in other communities, and you learn about what they're doing and how you can apply that certainly today.
Yeah, absolutely. And I think like that you talking about the farm worker healthcare issue, it's so very interesting because so many of them are seasonal workers that come here and they have no sort of healthcare, but they are the people that are picking and producing, well, they're picking most of the fruit that a lot of us are eating. And I know like an interesting story that came up in a community meeting I was in is that a lot of the farm workers that come here seasonally are getting the COVID-19 vaccine, and they're taking videos and showing it to their family back in like Mexico and places like that, because they are nowhere near to getting vaccines in Mexico, and they are just so happy about that opportunity here. And I think people are really thinking through that, because especially in North Carolina where I am, they're going to be coming next year, and how are we going to prepare for whether that's vaccines, what kind of healthcare? And I know there's a lot of like mobile health clinics, and just meeting them where they are, as it's so important. And it is quite an interesting issue that does come up, and as well as just like healthcare in general in the US is just very, very interesting.
Absolutely.
Yeah. So after your MPA, you went on and became the Vice President of Strategic Initiatives and Secretary of the college at Lebanon Valley College. So how do you come across this and get into this position?
Yeah. So, as I mentioned, we had gone through a merger process with Lehigh Valley. And so, my position was eliminated as part of restructuring. And, it was a point of reflection for me.
Can I ask a question about that? So how does that work? Like when they are coming to the merger, like how soon before you are losing your job do they let you know and things like that?
Well, our merger ended officially and became officially approved with Lehigh Valley on January 1st of 2017. And I was only part of Lehigh Valley for 26 days. And so my last day was January 26th of 2017. And all along, throughout the whole process of a merger, I was actually part of the merger integration team for Pocono. And, most all employees were always told, positions would be kept. We're going to remain, whole. We're going to keep going in that direction. And then obviously, there was a decision, that they made at a senior leadership level that there were certain positions that they just weren't going to keep, at that campus, and certain positions that just would be either duplicative or they just didn't have a spot for in the organization. And so ultimately, they made a decision. Mine was one of them. Had nothing to do with me, nothing to do with the work I did. Just ultimately was just not a position that they were going to keep. And so historically, in those types of circumstances, they offer a severance package, and they offer to at all times share with any future employers that you were an employee in good standing, and ultimately your position was eliminated, nothing because of you, but just entirely on organization restructuring. And so that's what happened. And when I look back in my career, that was a turning point in some way, because while I saw it coming in some ways, there was still a part of me that would say that's not going to happen to me. Like that's not going to happen to me. And a lot of that I think was because of the work I did in the community. And I will tell you that members of the community, I still hear from them. I have relatives that live in the area, and people will often say to me, Geoffrey, we still miss you and your team, the work that you did in the community. And sometimes I get a little nostalgic about it because it was truly labor of love. But business decisions are business decisions, and I respect that. And what I learned from it was that you can be the you can do the you can have your heart and soul devoted to something, but at the end of the day, a business decision is still a business decision. And so you don't ever be salty about it. You move on. You realize that you were there to serve, and you were called to serve somewhere else. And so, at the time, my wife was pregnant with our second child, and so that was an interesting time to say, "Oh, you're out of a position." But you trust the process, and spend some time. Again, I had a severance, and so still was quote unquote working, but not really working. And so I had an opportunity to really think about what would be next. And as I mentioned, I did a lot of work with colleges and universities. And so, healthcare in our community was going through a lot. There weren't going to be opportunities for me, particularly with the competitor organization, because they weren't going to hire me because I had been the face of Pocono. And so I said, you know what, higher ed is a place where you could do similar work, but you can have a better work-life balance. And for 9 years, I was on call 24/7. For 9 years, I took calls at all hours because I oversaw, public affairs too. And in 9 years, I would have to leave my home at all hours to respond to the hospital because there was a trauma incident and I needed to be there to ensure things were handled right. And so there was a part of me that said, you know what, I'm going to look for something with a little bit better work-life balance. And so I did. And, went through a national search, obviously was chosen as the Vice President of Strategic Initiatives. It wasn't that dissimilar from a lot of the things that I did, at the hospital, because, the college, while it wasn't a healthcare provider, had a number of healthcare programs, was really working closely with the community to advance, initiatives around economic development, community development, as well as I helped them as well to develop new healthcare programs like speech language pathology, new masters in clinical psychology. So I was doing a lot of the same things, but just doing it in a different way. But then ultimately, through some of that work, ended up getting recruited to Harrisburg University, because I was actually doing some partnership work with Harrisburg University. And the opportunity was a challenging one, because while I enjoyed my work at Lebanon Valley College, Harrisburg was bigger, and certainly sometimes things just make it too difficult to not accept it, and so ultimately did. But the position was exactly pretty much the same. It was an executive director title, but very focused in essentially the same work. But what Harrisburg University allowed me to do was to further refine my love of public health, actually. And that really came through because of COVID. So, my work there was, again, develop our academic programs in healthcare, work with our faculty, partner with industry, and partner with the Department of Health to partner with anyone in any aspect of healthcare to advance healthcare initiatives. And so, as it stood, I was already serving on the state health secretary, Secretary of Health Office of Health Equity Advisory Committee. At the time, that secretary was Dr. Rachel Levine, who's now our Assistant Secretary of Health in DC. And I was very involved in those initiatives, very involved in a number of other initiatives, and then COVID hit. And so, a lot of my time in 2020, while I was with the university, was entirely spent on helping the state, helping Pennsylvania with our COVID response, and really working in through the lens of health equity in that response, working with our healthcare systems, working with other nonprofits, making sure we were doing the best we could respond with health equity in mind. And I was tasked by the Department of Health to facilitate a group focused on our 60 and older population. And so I brought together, public-private partnership that included folks from the state, government, as well as industry, senior living, nursing homes, etc., so that we were keeping in mind what were the equity concerns as much as possible, raising them up through that process to the secretary, to the governor's office. And that actually is a process that still is in place today. And under our secretary, they created a COVID-19 health equity response team. I became a leader in that process and continue today. And so that's where a lot of my time actually ended up being spent in 2020. And then, obviously continuing to build relationships and partnerships to support healthcare workforce was a major aspect too.
Okay. And I think it's just important to highlight that the skill sets that you're picking up in these different settings are very transferable, from a healthcare setting to higher education setting to a public health setting, as well as just networking, building relationships, and having that skill is just so transferable. And it seems like you have a great amount of expertise in that. So that has definitely shown in the different roles that you have come across. And then, as well as during your time as the executive director of Harrisburg University of Science and Technology, you got a certificate in healthcare leadership at Duke University. So tell me a little bit about what you learned from that.
So that was a really awesome certificate, because it was very much focused on leadership development. And so the cohort, it was a cohort-based program, all online. It was very much focused on bringing together healthcare leaders and professionals at all different levels of their career. And while it was online and cohort-based, we would engage with one another. And obviously it was during COVID, so it was a great network that supported one another. People would share, their challenges, and we would talk about it and encourage one another and support one another. But it was very much focused on leadership. And so it first looked at you as a leader. How can you be the best leader that's possible? And then recognizing that reflection on you as a leader, how does that transcend into the opportunity to be a leader within an organization, within a setting? And so then it would work through all the different elements in a skills-based manner to help you understand how important that was. And so it was, a very much personal professional development type of certificate. And obviously Duke, being a leader in this space, certainly added to it. But the one thing too that I loved about it was that, faculty obviously were involved, and it was asynchronous. So we would have brief lecture recordings, but we had facilitators, who were involved, who were current or retired healthcare leaders in various different environments. They were the ones who were giving us feedback. They were the ones encouraging us. They were the ones helping us. And so that was really neat as well.
Okay, yeah, that sounds like an awesome certificate. And like as you said, the cohort-based certificate as well probably was very helpful during COVID. And I wanted to ask more about that. Like you said, you were doing a lot of the strategic work, and then you had to switch probably like most of the work that you're doing towards COVID. What was that shift like for you?
I was already working very closely with a lot of those folks and had been, just because of different committees and stuff that I was already involved in. So it wasn't really, that difficult. And honestly, it was a moral responsibility. And so, I have always been, and again, it goes back to my career trajectory. I've always been a believer in that when you have situations like a crisis, a challenge, that government's going to have to help solve, you got to bring public-private partnerships to the table to help. And that was very much my lens, was helping to do that. And so in a job where you're working to build partnerships and around community development, community health, it was my responsibility. And I brought our faculty to the table as well. One of our faculty members there joined me as a leader over the group focus on women and children and the COVID impact, particularly within that population. And so it was what we needed to do. We were the university closest to the Capitol. We did a lot of work with the Capitol, government, et cetera. And we wanted to ensure that they weren't alone and that they had a university that was going to be there to support them. And to me, it was our responsibility.
Okay, yeah, definitely. And I think that's so important, like the public-private partnership. I think it lacks in a lot of different ways. So like thank you for speaking on that and like doing that work to bring that together, because that's like hugely important. And I feel like it is very impactful when all of us could align, or at least see which parts of the strategies do align and come together to work towards a better outcome together. And then your current role is a senior vice president at Dignity Health Global Education. So what was that transition like from that old role to this new one?
Yeah, so I was recruited here similarly, didn't seek it out. It's been really good. I mean, to be honest with you, it's not very different from what I did at Harrisburg University, but really now doing it at a national level. And so, I would be remiss to say that even during my time at HU, where I still am as well. So instead of an administrative role, I've moved over to faculty, and I'm part of the population health faculty, where I will be developing and teaching a course on policy in population health. And also I work with the faculty on a number of grants that they have with the state. One that actually deals with the state health improvement plan, which was an initiative I partnered with the faculty to get the university in. And so I will be working with them on that because when I commit to something, I always do it. That's just how I was raised. And you never, even if you change a position or whatever, you just do it. And so, however, the one thing I should mention too is there were two things that also came out of COVID, which one was I had the privilege to serve and still do on the National Health Equity Task Force, which is run out of the Morehouse School of Medicine, Satcher Health Leadership Institute, where I was part of a group of 40 to 50 leaders from all across the country who were working with the government. Actually, we were, tasked with working with the CDC and Health and Human Services. And, we were raising issues around health equity during COVID and continue to. And then we developed a health equity tracker. I'm not sure if you have seen that. And when I say we, Google did. Google actually created it. We were advisors to the process and making sure that it would have impact, making sure that it was reflective and representative of different communities, and also spoke to people in a manner of health literacy. And so that was an amazing process to be a part of, with an initiative led under the likes of Dr. David Satcher, who is our former Surgeon General, and leaders like Daniel Dawes, who was one of the foremost advocates for the Affordable Care Act, and who, if you ever want to read a really good book that in many ways parallels public health, social determinants of health, and the vital aspect to the political determinants of health, which you can never talk about public health and not talk about the political determinants of health. Dr. Dawes wrote that book, and it's a phenomenal book that I'll actually be using in the policy course that I'll be developing and teaching. But I've had the privilege of serving alongside those folks, and it has just been amazing to see and learn more. As I mentioned earlier, this issue of health equity has been important to me, and to be able to serve on state committees and then take it to a national level has been, without question, very fulfilling in service. But the other thing that came out of COVID too was because the work that I was doing with the state, we ended up being nominated. And when I say we, two colleagues of mine from the Department of Health here in Pennsylvania, and a colleague of mine from the Department of Aging. And we were selected as fellows with the National Leadership Academy for Public Health, which you may have heard of, NLAF. We've been in this fellowship for a year. It'll conclude, I think, in December. And we have been working on an initiative here in Pennsylvania, all came out of COVID, relating to addressing social isolation, particularly of our 60 and older as a result of COVID. And that obviously speaks to the digital divide, the challenges that obviously that population has had with COVID. And so we've been working on that. And if you're not familiar with NLAF, I would definitely check it out, because I think actually right now the next selection cohort of fellows is still open. And again, very similar to National Rural Health Fellowship, NLAF is very similar because they only select, it's less than 10 teams. Every team is somewhere from 4 to 5 people. And you are brought together from teams. I mean, in our group, we're the only team in Pennsylvania. There's a team from Michigan, a team from Colorado, a team from, I think, Louisville, Kentucky, and others. And it has just been awesome. And we have, monthly webinars. It's also out of the CDC. It has been another really positive learning experience, and also a great networking experience. And again, you see the power of public health through this type of a process as well. So for me, when I was recruited to Dignity Health Global Education, obviously Dignity Health was founded by, Dignity Health Global Education was founded by Dignity Health, which is now part of Common Spirit. And so the opportunity to become a leader within an organization that is entirely committed to creating equity in education, which will then lead to equity in healthcare, was important to me. Not dissimilar to the work that I've done at a state level, but now have the opportunity to do it at a national level with amazing leaders and passion involved. And so, healthcare across the board has its challenges, as you know, with workforce. Public health does too, without question. And this pandemic has just further highlighted that. And certainly the politicization of public health has made it so much harder, just like it has on our nurses and doctors and others throughout our whole continuum. And so, I'm privileged to be working and serving where I can help hopefully make a change and hope to advance these causes and do it through education, because we know that education still by far, the pandemic has further shown it, is what can help an individual make it through tough times. Certainly can help be the difference in getting a job over someone that doesn't have it. And also just that aspect of advancement. And I will say that in my healthcare career and in my higher ed leadership career, what I've seen across the board is that we have to be dedicated to empowering and in many ways helping to groom those next generation of leaders at all levels of healthcare. And I'm very committed to that. I saw it as a young leader myself, where, at times young leaders are not valued exactly for who they are, for what they bring. And when I speak to fellow young leaders, I always say, you own your destiny. Don't let anyone tell you, I'm a millennial. And we all know they want to tell us millennials that we're lazy, that we don't do stuff, we don't have a work ethic. And I always tell people, don't listen to anything people say. I'm not gonna, and I encourage everyone else, don't let anyone define your generation. Because you know what? Everyone brings something else to the table. And if we take the chance to listen, we may hear something that we've never heard before. And I've been fortunate to have leaders and mentors that have cared for me in a way that has, without question, allowed me to thrive and flourish and grow. And I am indebted to them. And it's my responsibility to do the same. And so it's an amazing opportunity to help do that. And obviously, to work on the Equity Impact Scholarship is certainly an important element to that as well. And so I'll kind of stop there because I'm sure you have other, questions.
Yeah. My other question, I was just about to ask about the Equity Impact Scholarship for more equitable healthcare workforce. So tell me more about that.
Absolutely. And I apologize when I'm coughing. Allergy season is never easy here in Pennsylvania. So yeah, the Equity Impact Scholarship was created by Common Spirit Health with the clear recognition that, again, we've got to create more equity in education. And by creating more equity in education, we can create a more equitable workforce. And that really gets to the heart and core of, we've got to look at how do we advance diversity, equity, and inclusion in the workforce? How do we reach people who, inherently and systemically, it's going to be harder for them to ascertain a degree or a certificate? How do we do it in a way that doesn't make them have to jump through hoop after hoop after hoop just to get financial aid? And how do we do it in a way that can bring new people into healthcare? And so this scholarship is entirely for current people in healthcare, as well as other people who want to get into healthcare. And when I say healthcare, it's broad. It's acute care, it's pre-hospital, it's post, it's public health, it's every aspect of healthcare. And so, Common Spirit created a $3 million Equity Impact Scholarship. It includes all the certificates that Dignity Health Global Education offers, as well as our degree programs. And, just to give a sense of some of the certificates range from a certificate in healthcare leadership from Duke, certificate in nurse leadership from Duke, certificate in innovation in healthcare management with Arizona State University, 2 mini MBAs, a mini MBA in healthcare and a mini MBA in rural healthcare with Eller, University of Arizona. And then we also have a certificate in healthcare marketing and certificate in healthcare analytics with Pepperdine, and then obviously offer a number of degree programs as well, which include an RN to BSN, and then a brand new MBA in healthcare with Northern Arizona University. What's powerful about the scholarship is that for all of the programs, as I mentioned, individuals have an opportunity to earn either a certificate or a degree for a significantly reduced cost. And so, if you take a certificate, for example, hypothetically, say it costs, just under $2,000, such as our Duke ones, you could earn that certificate for less than $500 scholarship. If you look at the degree programs, in particular, the RN to BSN, an area of healthcare where we have a shortage is nurses. So for a nurse who wants to upskill and take that next step, earn an RN to BSN, it's a $10,000 degree. They have an opportunity to get $7,500 towards that. Pretty significant. And I know I had shared with you earlier about the new MBA in healthcare. I'm really excited about this because it's with a top-ranked public institution in the whole United States, Northern Arizona University. And it's under $20,000, but with the scholarship, a student could earn up to $9,000 of scholarship. And so This is important. And thus far, the scholarship committee has awarded scholarships and many scholarships, but there's still many available. And the impact, the stories that we have heard from the applicants have been all inspiring. There is no doubt of the fulfillment of the vision that Common Spirit had here in what we're seeing in the applicants. The opportunity that we have with them to upskill, reskill, to give them hope at a time when things have been tough, to give them personal, professional, and leadership development that's skills based, and all programs that have been developed for healthcare by healthcare. The opportunity to learn with facilitators that work in healthcare, not just faculty. Faculty, yes, they're an important part of it, but also people that are in the industry who can share with them real life examples. And so it's truly the beauty of bringing academic experts with industry experts and delivering it in a personalized way for our future leaders. And so it's a wonderful opportunity.
Yes, absolutely. And I think it's so important, like to your point, that we need equity, and education is a huge part of that. And we've seen that throughout the pandemic, just how important it can be. And I think like that in itself is a social determinant of health, and reducing those barriers to getting that education and creating these types of opportunities are more of what we need to get more people of marginalized communities into these kinds of positions where they are able to help their communities and be part of those leadership structures and actually like affect change. So thank you for that. If someone is interested in this, where can they go to find out more information?
Absolutely. They can simply go to dhge.org. And when they go there, that's our webpage. They will see right at the top, it will automatically pop up and it'll say, we've launched a $3 million Equity Impact Scholarship in partnership with Common Spirit Health with over 1,000 scholarships available. They just have to click Learn More, and it will immediately take them to a part of the page that will literally walk through the scholarship, tell them about the programs, and then they can apply. And the application is simple. They're literally just giving us their name, their contact information, which program interests them, and then they have to write a personal statement of 800 to 2,000 words. Simple. It's their personal statement. It's all about why is diversity, equity, and inclusion in healthcare important, and how will this education allow them to advance their career and advance the issue and causes of diversity, equity, and inclusion within their community and in healthcare. And that's how the scholarship committee reviews it. It's entirely on that. And there's an optional section if they want to share, a little bit more about the organization they come from, a little bit more about their cultural, ethnic background, but that has absolutely nothing to do with whether they get a scholarship or not. The reality of it is that if people respond to the personal statement, they're going to get a scholarship. If they don't, they're obviously not going to get a scholarship because they at least have to do that. And honestly, what we found from being compassionate is that some people, just need a little help, and that's what our team will do. We will help them. We'll give them guidance because you know what? Not everyone has had to write those types of things before. And from a lens of equity, we've been very committed to helping people because we know that that's what would be the expectation of what Common Spirit did in creating this. And so our team will work with them. We've had situations where someone writes 600 words, and obviously, there is the request for 800. We'll give them tidbits to help them get over that because that's what we've got to do. This is about lifting up one another, not making people and making it more difficult for one another. And so this is just a wonderful opportunity, again, to create more equity in education that ultimately can lead to a more equitable workforce in healthcare and good opportunity to help people. Yeah, and you are absolutely right. It is a social determinant of health, which people often forget.
Yeah, absolutely. And that is awesome. And I'm definitely put the link to that in the show notes. So everyone go and check that out. That is definitely an awesome opportunity if you're interested. So yeah, I appreciate that a lot. And then I wanted you to talk about one of your career highlights that I saw on LinkedIn. There are quite a few there, so definitely check out Geoffrey's LinkedIn as well. So I'm just going to read it out here, and then I'll let you speak a little bit more to it. Generated 150,000 in federal appropriations and $2 million in state economic development grant for health systems growth plans, and supported the management of capital campaign of the new Hughes Cancer Center with 34 million, and elevated funds by multi-million dollars through achieving partnerships with area schools, organizations, and companies.
A lot of what you're speaking there occurred during my time at Pocono Health System. One of which was one of our strategic plan items was to build a new cancer center, which was to go from a roughly 7,000 square foot cancer center to a cancer center that was over 30,000 square foot. And obviously that became a capital campaign because cancer care and cancer was the top leading cause of death within our community. And thus we needed more room. We needed more access for chemotherapy, for radiation, and for all the care support systems that were needed. We were also at the time a partner with Jefferson, which was obviously a national leader in oncology as well. And so I was obviously tasked with helping on that capital campaign. And my particular area was to develop opportunities to find government funding. And so, was fortunate to bring into that initiative both federal appropriations to support some of the medical equipment, actually through the United States Senate at the time, as well as state government dollars, particularly over $2 million to support the cancer center, which ended up having to get approval from our 3 county commissioners, our 4 state representatives, our 6 state senators, and then as well as the governor's office. And so fortunately, I was able to work with the whole team and lead the team to bring that forward, and then did that again when we were developing our outpatient medical homes, which were very integral for us in bringing care to communities that didn't have the access that they were going to get then. And really, as you know, hospitals oftentimes have a lot of patients who use emergency rooms for areas that are just not emergent. And so these facilities were developed in more rural parts of the community to bring care into the community as a result to try and keep people healthier and give them access to primary care. I mentioned earlier, give them access to outpatient psychology, behavioral health, as well as a number of other specialties. And then obviously I was fortunate again to get state funding to support those initiatives as well. And so, at the end of the day, I always say to people that, there in your career, there will be times where you're asked to take on things that are very new to you. And you have to use your budding desire to learn more, research, build relationships, and through that you can make it happen. And without question, for me, in a lot of these circumstances, those results would not have happened if I hadn't built the relationships first. Because to get a yes with an elected official and get that many elected officials, you have to work them. You got to help them understand why. And sometimes you got to help them understand why it's going to benefit them. And sometimes that's not the most fun because, for those of us that prefer to be more humble, you still have to think about that. And you have to think about what the story is. That's always the important element. Why? Why do this? Why do this now? And so I have learned in my career that if a leader asks you to do something, it should never be no. It should be absolutely. I may need your help to do it, but I'm so honored that you asked me to do that. And that's something I learned from my former CEO was that if you're willing to take on new challenges, new projects, your future can be so bright because not everyone's going to be as willing to just take it on. And sometimes you take it on and maybe you fail. That's okay. You tried. and you learn from it. You get back up and you get right back in. And that's what I learned. And, obviously, these results were not just mine, they were results of a team. And there was always a wonderful team, both my bosses as well as the team that I led, that were without question supporting every element of it as well.
Yeah, absolutely. Well, that is awesome. I'm glad that you all were able to do that. And I think it just goes to show like the thread of relationship building and the importance of that in your career, and then in most of everything that you've done up to this point. So I wanted you to, if you had any like tips for people who are more interested in wanting to be like a relationship builder or network builder, did you have any tips that you wanted to share?
For network building,
Yeah.
yeah, I mean, I think, the first thing that's important is that, um, everyone has to, think about how you can positively use, LinkedIn and those types of tools, because there's no doubt of how important it is to utilize a network like that, particularly for your professional network. But more importantly, I always encourage people that they need to have mentors. And for those of us that can, we also need to mentor. We have a moral obligation to help those in the way that we've been helped. And it is critical to do that. And I know I would not be where I am today if I didn't have phenomenal mentors in so many ways, both personally and professionally. And the second thing is I always encourage leaders at all ages to have a personal board of advisors. People who they can go to, people who can help hold them accountable. They can bounce ideas off of. Could be challenges with their career, but just a group of individuals who can just be there for them and be thinking about them. It's just very, very critical. And then the other thing, as I mentioned, is be willing to take on new challenges and risks. And as I mentioned earlier, don't let anyone define your generation. You define it. You show them what you can do. When I have had the privilege to lead teams and hire people, many people would often say to me, the way you hire is very different than other people. Probably because of how I believe in relationship building. When I look at who I have the privilege of working with, I look at that too. Is someone called to serve? Is someone willing to, open doors and build relationships to advance outcomes? Those types of things have always been really critical to me. And the other advice I would give is, and I preach on this all the time, is actively listen. In leadership, I just see so often that there are so many leaders who just, they've already have the answer before they've even heard the question. And that's a big pet peeve of mine because as leaders, it's our responsibility to listen, then respond. And, I think for those that come up the ranks, continue and become our next generation of leaders, that's important. And then the other aspect is the other advice I would give is don't give up. Don't give up on your principles. Don't give up in what you believe in. Don't get knocked down by the challenges that we have as a society. So many of them are systemic, but we can change that. We've got to change it. And I think we have to realize that comes through partnership sometimes. And we know it's not going to be overnight, but I think we have proven time and time again that it is possible if we're willing to put our hearts and minds to it.
Okay, absolutely. That's some great insights and advice there. So thank you for sharing that. And then before we move on to the Furious five questions I ask all guests, I wanted to ask, where would you like to see yourself in the future?
Yeah, so it's always hard to say. I've always said that without question, at some point, hope to one day get back into a healthcare environment directly, possibly in a role that's over, strategy, community engagement, community health, in a more senior level role like that. at some point in my career. There is also a part of me that, can't sit here and ever say I don't think about the opportunity to go further in elected office. That has been a dream since I was a young kid, and should I have an opportunity and realize that that would be a way to enact systemic change in causes that I feel deeply, that may be. You just never know. But without question, whatever I do, it has to be mission-based, mission-focused, and it has to be around advancing initiatives or outcomes that support people, particularly in healthcare and education. Those are definitely the two areas that I have felt called to serve.
Okay, awesome. And I look forward to following your journey and then seeing where you do end up in the future. So moving on to the Furious Five questions I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health or health administration?
So if they are considering a career and they choose to do an academic program, make sure you absolutely do an internship and leverage that internship. I actually would say the more internships, the better. I have hired so many interns, particularly in public health and my hospital career. So many interns we hired, and it was because of the work they did during their internship.
Yeah, that's absolutely great advice, and I definitely echo that 100%. Number two, if you were talking to someone wanting to get into your position, what advice would you give them?
Follow your dreams. Absolutely take on new projects. Be willing to. Definitely, without question, consider your education options, because I know I would not have gotten some of the positions I did without getting that master's. Despite the fact that I don't always agree with that, there are still ways that organizations view that you have to have it. And so I think that's important. And the other thing I would say is realize that everyone has to start somewhere. And so, as I mentioned, I started in an entry-level role too. But you see, 13 years later, that I've had the opportunity to advance. And for me, fortunately, I've advanced, often. Other people can too. And those of us that are here for them will always be there to help them advance.
Awesome. Number three, what's something you're working on improving in your life right now?
I think across the board in such a trying time with COVID, as I mentioned, the politicization of everything is very trying, and sometimes you get frustrated about that. And so I'm always trying to keep my eye on the ball, stay focused, and not get drug into truly such a nasty part of what shouldn't be, particularly public health, caring for one another. And so I'm just trying to stay entirely focused on not getting pulled into that. And I'll give you an example. I said I'm an elected school director, and the masking challenges and the masking debates have been very real. And there have been times in those discussions where it's really hard for me to sit there and just not say, "Are you kidding me? Like, I must be missing something." And obviously, the better angels take the win and say, "Just let it go, Geoffrey." Some people are just going to believe what they believe, and you just have to let it go. But that's an everyday thing, and I have to just continue to work on that too.
Yeah, and I definitely think that is a challenge that a lot of people are dealing with these days. Number four, professionally, do you recommend anything?
I think professionally, I'm a big believer in, being part of organizations, whether that's membership organizations, societies, whether it's in your career or even personally. You get a lot of benefits from a networking perspective. And that can come, as I mentioned, even through fellowships, as I've done. There's just a tremendous amount of benefit that you get from that opportunity to learn from others from around the world and sometimes global.
Yeah, that's great advice. And then last but not least, where can people connect with you?
People can connect with me on LinkedIn. That's probably without question where I'm the most active. Um, and I'm always happy to connect with anyone and everyone, frankly.
Yeah, absolutely. That's how we connected, and we got to get this interview scheduled. So I'm happy we were able to connect. And just thank you so much for taking time to come on and share your story and your insights and about the equity scholarship. I know a lot of people are probably excited about that, and I just think there's a lot to come in the future, and I look forward to seeing your career progression continued and all the great things that you do. So thank you.
No, thank you as well, and thank you for all that you do as well.
Yeah, my pleasure, my pleasure. And then housekeeping items, everyone. Thank you so much for either watching this or listening to this. I greatly appreciate it. Make sure that you subscribe. Make sure that you leave a review, that you like this if you're watching this on YouTube, and make sure to share it with a friend. And if you do want to support, you can go to buymeacoffee.com/the PH Millennial. Thank you so much.